Hi guys, this is Justine Calderwood. Tonight for the live video, I'm going to show you a self-care routine. So I'm going to actually hold the releases that we're going to do for a little longer, for the 3 to 5 minutes, so that we can release the fascial tissue. So I'm here at my house. My husband and 2 daughters are outside building a tree house. So if you hear the saw going, that's what's going on. It's not ideal, but this is COVID times, okay? So what you're gonna need for the self-care routine, you can get a mat if you want it, or just your floor. If you have essential oils, I'm gonna have you grab them. I use Young Living because I trust the quality. They're therapeutic grade. I'm gonna use Joy tonight. A small inflatable ball if you have it. If you're a patient of mine or have been in the past, you should have one of these. And for the last thing, you can either have a towel, or if you have a foam roller, you can grab that. I like to use the Smart Roller, and I'll explain that when we get to it. So I'm just gonna take you through just a like 15-20 minute self-care routine. And again, we're gonna hold these long enough so that we're engaging the fascial tissue, and I'm gonna walk you through this, okay? So what I'm gonna have you do is just, you can sit on your mat or on the floor. You can take the towel and put it up underneath your bum if you want it. It kind of lifts your hips up a little bit, so just fold it and you can lift it up like that. Okay, and I'm gonna take my socks off. All right, so what you're gonna do here, what I like to do is first start with my oil. So I'm gonna put a drop or two in my hand, and then I just swirl it around, and I put it at, a lot of times I put it at the crown of my head, my forehead, my heart. Sometimes I put it around my ears. There's a lot of nerve endings around your ears. Okay, and then I just like to take the last little bit, and I just like to inhale. So it only takes 3 seconds for essential oils, for anything you breathe in really. It only takes 3 seconds to get to the limbic system of your brain. That's the memory emotional center. So I'm just gonna start to kind of ground down in my body, and I like to close my eyes so I can really focus on what I'm feeling. When you use oils, it only takes 26 seconds to start showing up in the bloodstream and in the thyroid and the heart, and so they work very, very quickly. And within about 20 minutes, all the cells are resonating at whatever frequency oil that you're using. So for Joy, I think it's like 180 megahertz. So it's gonna raise my frequency a little bit. So if you're feeling fearful, if you're feeling some of those negative emotions, try using some therapeutic grade essential oils so that you can start to raise your vibration, raise your frequency, and you may start to feel a little bit better, okay, emotional wise. All right, so I'm just gonna start to ground down. So I'm gonna walk you through this. So you can put your hands, you know, face up, face down, but what I'm going to have you do is just start to feel down into your pelvic space. So bring your breath all the way down into your pelvic space, into your root. And you can just breathe in and out. So we're not going to do yoga, but it is very, very important to connect with your breath. And you can even start to use your own intuition here. Let your inner guide you. So as we do this, I like to start to picture even roots just coming down from like actual roots coming from my pelvis, and feeling them ground down into Mother Earth and wrap around her center, so I can feel super grounded. And this helps to calm the nervous system as well. And then I just kind of intentionally just raise up through the top of my head and just start to lengthen out the spine. So we're going to get started. I'm going to show you a release for the spine, specifically for the dural tube. So the dural tube is the innermost spinal tissue, and it covers the spinal cord, covers the inside of the head, all of the cranial bones, all of the peripheral nerves. So think about the nerves that come off of your neck that go down into your arms, your thoracic spine, they wrap around your trunk, and the ones coming from your lower back go down into your legs. So the dural tube covers a lot of tissue in the body. So this is a really good one if you're feeling tight, tense, maybe you're working from home, maybe you're off work, maybe you're worried, whatever. And there's a lot of changes going on. I don't have to get into all of that right now. So what I'm going to have you do is grab your small inflatable ball. If you don't have one, don't worry about it, okay? You can still get benefit from this. But what you're going to do now is just lie down on your back. And you're going to take your ball and just bridge up. And you're just going to put that at your lower back. Well, actually, I like to put it at my sacrum. If your sacrum hurts, so the sacrum is just that triangular bone at the very end of your spine, okay? If your sacrum hurts or your coccyx hurts, you can put it off to one side. You can choose one glute muscle. It's okay. But I'm just going to go there. I'm going to keep my knees bent for this, okay? Because I don't want to overarch my back. Then I'm going to use my hands to release up at my head, okay? So I'm just going to put one hand behind my head, and I'm just going to lay the other on top of my forehead. And so now I'm just connecting energetically between my hands. So I'm just starting to picture, again, I'm using my intuition. I start to picture a nice glowing white light between my hands. And then I'm also just feeling and letting my hands sink in to, like, underneath my skin, into the fascial tissue. That's just the connective tissue of your body. So I'm just going to start to engage those fibers of the fascia. I'm starting to wait to see if I can feel some softening. You know what, I'm going to go ahead and straighten out my legs, so I get more of a stretch here. So it takes 90 seconds to 2 minutes for the fascial tissue to start to soften. So feel for that underneath your own hands. So I'm giving you some pretty powerful tools here for self-care that you can start to trust your own hands to treat yourself. Okay, so I'm starting to feel some softening. Now what I'm doing now is I'm starting to lift up my bottom hand up towards the top of my head, and I'm gonna draw my top hand down towards my nose. So it's almost like I'm taking, like almost picturing my head like a helmet, and I'm trying to just lift it up. And I'm feeling down into my neck and my upper back and all the way down to my feet. So I can start to feel I'm not sliding on the surface of my skin. So again, do not slide on the surface of your skin. You're down deeper than that. Just very gently nudging the tissue and see where it wants to go. So you just engage the tissue, you wait at the barrier, so you take up the slack. As your body starts to soften, your hands will start to move even more. So let the body guide you. And you start to just tune into that fascial tissue. Where does it want to go? Your hands are no longer in control. It's your body that's leading you. And then I tell, when I'm doing this with patients and when I'm doing it with myself, starting to tune in, where else am I feeling this in my body? We call that the fascial voice. Your body will tell you exactly where it needs treatment if you're willing to listen to it. So I'm actually feeling this tug in the front of my hips. My hip flexors are tight. I'm also noticing that my hands are gliding, my bottom hands are gliding up towards the top part of my left skull, and my top hand is gliding toward my right eyeball. So I feel kind of a twist. And every time my hands move, I'm just following it. So allow your body to soften more and more. And I know I'm doing a lot of talking. I don't normally talk this much when I do a treatment. You may also start to feel your bottom softening over top of the ball. Just keep softening. So sometimes you may start to notice that things get a little uncomfortable. Stick with it, meaning as you feel that discomfort in your body, bring your breath into it, go into it and see what's there. And as you pay attention to it, usually it will start to ease up. It'll start to let go. That's a restriction you feel. Something's in there. And be open. Sometimes it's a memory or an emotion that needs to come to the surface, and just allow it. So we hold releases 3 to 5 minutes, sometimes longer. You can't over-release the fascial tissue unless you're forcing it. But if you're following it and letting it soften, you're not going to injure yourself. So just keep softening. So just to let you know what I'm feeling, my hip flexors are relaxed now, but I'm feeling it in my throat. Front of my throat feels tight. So my body's telling me that that's where I need treatment next, okay? So you get the idea here. I don't have a timer on me, but I'm assuming that's at least 3 minutes, okay? So I'm just gonna ease up my pressure now. I'm not just gonna just let go. I don't want that rebounding of the tissue. Go ahead and bend your knees. You can bring the ball out from underneath if you'd like. All right, I'm gonna put the ball back under, and I'm gonna show you what we call an ear pull. This releases up the temporal bones. So this is a really good one if you're feeling some head tension, okay? So temporal bones are just above the ears. So if you're feeling headaches at all, or feeling this tightness, or even if you're experiencing some jaw tightness or jaw pain, this is a really good one. So I'm just gonna put my hand, or my hair behind my ears. So you can use the ball, continue to use the ball if you'd like. It's not necessary. But what you're gonna do now is you're just gonna take your hands, you're gonna grab a hold of your earlobes up towards the top, or you can even grab down below on the earlobes themselves. But just so you can see a little bit better, I'm gonna grab a hold above the top here. And all I'm gonna do now is I'm just gonna pull my ears out away from my head a little bit, just until I start to engage the tissue. I'm not forcing anything. And then I'm gonna pull up towards, like my fireplace there, up towards the top of my head, okay? And I'm gonna straighten out my legs here. So all I've done is take up the slack of that tissue. And again, it's gonna take another 90 seconds to 2 minutes to start to release this soft tissue. So I'm gonna wait. So when you do this, just let your body soften always. You may start to feel like my eyes are twitching because I have a lot of tension in through my face and my skull bones. You might feel a warmth. You might feel discomfort. Again, memories, emotions might come to the surface that you need to just be aware of. Previous injuries. Okay, so things are really starting to soften now. And now, again, I'm giving up control to my body to show my hands what they need to do. So I'm not sliding on the surface of my skin. I'm letting my body just soften. And what I'm noticing here are, I'm feeling a twist again. My right hand is going up towards that treadmill, and my left one is going up towards the wall behind me. So you follow the tissue barrier upon barrier. What that means is sometimes it'll come to a stop, and then it'll start up again. It'll start moving again. So again, I'm feeling this in my throat. stomach. Feels jittery. So my body wants to go into an unwinding pattern, so I'm going to let it, even though I feel super vulnerable right now, whoever's watching this. So there's a part of myofascial release called myofascial unwinding, and that's your body allowing your body to spontaneously go where it needs to like more of a movement, to unravel the tissue. So you take off your brakes, meaning you don't care what other people think of how you're moving, and you just let your body move. I love to do this one when I'm falling asleep at night. Oftentimes I'll just fall asleep like this. My hands will relax. So again, I can't see my timer, but I'm going to assume we hit at least 3 minutes there. And then I'm just going to let go, nice and easy here. Okay, I want to show you one more, possibly two, we'll see. One more release, okay? So you can use your ball now. We're going to do a chest opener, okay? A lot of people sit at their desks, you know, using your phone, kind of hunch over, that kind of thing. So if you're experiencing neck pain, again, headaches, any kind of shoulder pain, even if it's in the front, then, you know, opening up the shoulders can really take a lot of strain off the head, because it's not, if you have a lot of tightness in through your chest and your shoulders, it's going to pull your head forward, okay? And as you pull forward like that, the muscles in the back are trying to keep you upright, and they get overworked. And gravity just takes hold. It takes a lot to hold your head up like that. So you could either use your ball here, a foam roller, or a towel. So I'm going to show you all three. So if you're going to use the ball, you can simply lie down on your back. Just put it about bra line if you're a woman, nipple line, okay? And you just lie back onto the ball. If it hurts, if it's tender along the spine, then put it off to one side into the shoulder blade, okay? So that's one way. You could take a bath towel. If you don't have a ball, just take a big bath towel, and you're just going to fold it and then roll it up lengthwise like this. All we're doing here is creating something to lift the chest up. So you can put it down like that, or you could use a blanket, I suppose, and then you could just sit on it, okay? Again, we're just using it to lift up the chest, to let the shoulders drop down, okay? The third way, if you have a foam roller, I prefer these smart rollers, especially if you have balance issues, because it doesn't roll quite as well, and this one's softer than a regular foam roller. So I'm going to use this. I'm just going to place it here. I'm going to sit on the end of it. So I don't advocate for rolling out muscles. I use a foam roller simply for posture or positioning. So from here, all I'm going to do is put my hands up, palm up, about shoulder width. So I'm making a T with my body. Okay, and I'm just going to now, I'm going to keep my knees bent. And all I'm going to do here is soften my body and start to open up through my chest. So one thing you could do, if you don't have a lot of neck pain, you could bring your head off of this and really open up through the front of your neck, okay? So I'm going to actually do that. Can you guys still see me? Okay. So from here, I'm just letting my head go into extension so I can really feel this up, because I have a lot of restrictions in through my throat and the bottom of my jaw, okay? And we're just going to hang out here. So you can kind of intentionally lengthen out through your arms. So picture yourself like attached with like strain basically. And you can set an intention to kind of come out from your shoulder, your chest, out through the tips of your fingers, and out through the top of your head, and down through your spine. So one thing I want to point out, the soft connective tissue, fascia, covers every single cell in your body, and there's no start and end to it. So it's one continuous thing, head to toe and front to back. So this is why it's important, regardless if you're doing whatever stretch, whatever release I've shown you, you may feel this anywhere in your body. And I really highly encourage you to start listening to what your body's telling you, because it'll tell you exactly where it needs your attention, where it needs some care, if you simply listen to it and take the time to take care of yourself. So research has shown that around 5 minutes of holding a myofascial stretch, holding these releases, it starts to release interleukin 8, which is your body's own natural anti-inflammatory. It releases other interleukins, which help with boosting the immune system. So one thing you can do from here is just bring your arms up a little bit if you have the mobility, okay? So bring it up into like a Y position instead of a T, and you'll start to get the tissue to stretch down into your pec muscles a little bit more, down into the breast tissue, okay? This is good if you have any, say, scarring. I have women that have had, you know, breast surgeries or open heart surgery, that kind of thing. So doing that can really get into the chest and really start to release that scar tissue, which really is just fascial tissue that has gotten so bound down. So take the time to do that. I'm going to end with one last thing here, just because I'm feeling like I need it. I'm just going to sit here and kind of start to open up through my hip flex or my hip adductors. And I'm going to show you just a stretch for your neck, okay? So you can grab a hold of your feet if you have that mobility, okay? And what I'm going to have you do is just lift up through the top of your head and just start to tilt to the side. And you can angle your looking either down towards your armpit, or you can look up towards the ceiling, and that's going to change where you're feeling it at in the neck, okay? I'm not going to hold this long enough, but you can work on both sides there. This is a really good one just to lengthen out through the spine and to get up into the neck, okay? All right, hopefully you guys enjoyed that.